Hi, today I'd like to talk to you about one of my other roles here at St. Louis Children's as a pediatric ear, nose, and throat specialist. I believe very strongly in taking care of a child as a whole, and part of that is to be involved with multidisciplinary care. Since I've started here, I've always been involved with the Cleft Craniofacial clinic. These kids, many of our children may have cleft lip and cleft palate. They may have other issues that can involve the craniofacial skeleton. We're a group. We're a team of providers who help to take care of you and your family. That includes a team of pediatric plastic surgeons, pediatric ear, nose, and throat specialists, as well as pediatric dentistry. And that can also include speech pathology, audiology, where we assess hearing, as well as psychology, and sometimes genetics, as well as some of the other services that can be involved. I'd like to focus a little bit more towards cleft palate. Well, as you may know, with the cleft palate, children are frequently develop this while they're in utero or within the womb. More and more, we're beginning to recognize this during prenatal visits. What happens if your child is diagnosed with a cleft palate before they're born? In many ways, it's much the same as soon as it's recognized right after a child is born. Our team of plastic surgeons and other specialists will meet with you to discuss why and to understand a little bit more about the process and the longer-term care and management. Most obvious are the changes that we can see, such as that involving the lip or the palate itself. Sometimes, though, it can include other parts of the body, including the midface, as well as the appearance of the nose. In addition, there are other less visible physical changes, such as those involving the ear and the function of the ear. It can also affect dentition, jaw alignment, and then, as intimated before, speech. While we will meet with you and regularly to make sure that your child is growing and gaining weight and feeding well, ultimately we'll start talking about procedures such as the repair of the cleft palate. Now, for a cleft palate, our team tends to like to do those surgeries somewhere around 10 to 12 months of age, depending on how your child is doing. Before that happens, while you've met with our nursing coordinators, especially our care coordinators, Sybil Sheevy and Cheryl Grellner, who are amazing and wonderful people, and you get to know them really, really well, you will also be meeting with plastic surgery. Now, just before the full palate repair, we'll have you meet the full team, and that's where you'll come in. As I'd mentioned before, our goal is to support you, both the patient and the family, and to consider you as a whole, not just the cleft, but the associated challenges that can come along. During that team visit, rather than meeting with different people on different days and trying to coordinate all these different appointments, we try to do this as a whole and on the same day. So it's a highly coordinated process, and these providers will include meeting with pediatric ear, nose, and throat, plastic surgery, speech therapy, audiology, as well as nursing, and even pediatric dentistry, knowing that families can deal with a number of different issues and we can help provide that support. The strength of this is that not only is this a very well-established team that's been around for a long time, so we like to help you with some of the expertise that we've had. The strength is that we meet regularly as a group. This is a weekly clinic. We have pre-conference and we have post-conference. And so we discuss together what we think are the key issues that are arising for that patient and for the family. And what are the issues that we can also help to try to address. Sometimes it may be as simple as, we're ready for surgery and we're going to go ahead and get that set up and to have coordinated care. And then as surgeries come up, for example, you'll have a lot more detailed information that comes through, what to expect, what happens afterwards. I would defer this over to my plastic surgery colleagues, for example, if you had questions specifically about the palate.